Good day, everyone, and welcome to the Super Talk. We're excited to be here today as we begin a new school year. In true tradition of the Super Talk, we're reaching out to key community members that have important information to share with us so that we can all benefit from that. I do want to thank everybody in the district for all of their hard work as we start this new school year out, and also thank our community for coming together. In addition, I'd like to thank our producer, Mr. Jake Berry, and also Dr. Ed Requenez, who's our guest today. And I would like Mr. Berry to give us a little bit of information about our special guest.
All right, we've got Dr. Edward Requenez, and he's a graduate of Stanford University and Columbia University Medical School. He completed his residency training at Columbia and at the New York Presbyterian Hospital, and he completed his fellowship training also at Columbia at the Morgan Stanley Children's Hospital of New York. He's a board certified in anesthesiology and pediatric anesthesiology, and he's a proud MISD parent, and currently his position at Rio Grande Regional Hospital is he's the chief of staff. Welcome to the show.
Thank you for having me.
Dr. Requenez, thank you for taking time from your busy schedule to be with us. I know that you're extremely busy right now, and please know that we appreciate everything that you're doing for us and all the hard work and the long hours that you're putting in. We appreciate you so much, and also thank you for making McAllen ISD your district of choice as a parent. I know that your children come to school here, and we greatly appreciate that. Do want to respect your time, so we will jump right into it with regard to some information we'd like from you as an expert in the field. And what's the current state of our community right now with regard to COVID-19?
That's a great question. Before I answer it, I want to say thank you for having me. And again, thank you for all of the efforts that you and everyone at McAllen ISD are doing while we've been working, taking care of patients and trying to educate the public and the community with regards to the pandemic and how best to keep things going as best as we can here in McAllen and in the Valley more broadly. We know that you all have been working very hard at trying to come up with the safest way for our kids to return to school. We've received all of the messages from your office, as well as from our principal and various teachers, keeping us updated. And it sounds as though you all have been also very hard at work over the last several months, trying to figure out what the best first step for returning to school in the fall will be. Let me make sure I remember the question at this point. What is the current state of COVID-19 in the community?
Yes, sir.
So I guess lots of different ways to answer that question. From just a casual, it's good or it's not good, to something a little bit more formal. If you look at the way that the CDC looks at what's going on in communities and tries to define it, it ranges from no to minimal transmission within the community, which is obviously not where we are, all the way to a sustained uncontrolled spread within a community, which is unfortunately where we are and have been for since about May, since the time of the reopening on May 1st in the state. So the current state of COVID-19 in our community remains sustained and uncontrolled. And that's reflected in the numbers that we see in our hospitals, because I think there's a lot of questions out there amongst people who live here in the community and are looking at us from afar, trying to determine, to what extent do we have what is the prevalence, or how many cases do we have at any given time? And I think our county's done a very good job of informing the public and coming out with daily announcements. They just announced yesterday that we have an estimated over about 4,000 active cases in the community in Hidalgo County currently. Depending on the source that you ask, if you look at the Texas Department of Health, they're estimating that our current prevalence is somewhere around 2,200 cases per 100,000 in population in the valley as a whole. So it it seems as though that the state is providing numbers that suggest that the numbers are actually much higher than what we're reporting at the county level. However, the proof is in the pudding, and the concern has always been that people would become sick enough to need to go to the hospital, and that the hospitals would become overwhelmed. That's not just been a concern here in the Valley, but a concern all over the world. And currently, we have over 800 patients still in the hospitals here in Hidalgo County.
And I know the numbers are high, and that's why I just want to thank you and all the other health professionals and in our community and really across the world that are dealing with this, and the courage and the bravery and the resiliency and this never say die spirit as far as just grinding and working is very, very impressive to see from the outside looking in. So on behalf of the entire McAllen ISD family and our board, I did want to thank you for that. And I wanted you to know that it doesn't go unnoticed. From an expert standpoint, what's the best advice you have for our community as it pertains to COVID-19?
I think that the most important thing for us to remember are what are the long-term goals of the community and the people that are leading our community, that are working at battling the effects of this pandemic, and that is to get things back to the way they were in the safest way possible. The goal is to get everyone back into school. When it comes, and so every student needs to go back to the schools that they were at as soon as they can. But the first thing that we need to do is we need to figure out when is it appropriate for us to do that, and we need to agree on the next best steps to get us there. If you look at what the governor has said in the past, back in May, he used a benchmark of a 10% positivity rate in testing as a marker to indicate whether or not things were looking good or looking bad. And here in the Valley, we remain at over 10% of the tests that are administered, and we have lots more tests being administered now than ever before. And the rate across the Valley still remains above 10%. So does that make sense? So if we test 100 people, over 10 of them will test positive. We're testing thousands of people. I think we're approaching 10,000 tests daily at this point. And this is across all 4 counties. So that's one marker. It's figuring out what data or what metric do we use to determine that we're making progress. The other one would obviously be how many patients do we have in the hospitals at any given time, and how many people are presenting to the hospital, on any given day. And we want to see those numbers decline from where they currently are, because those are a really good indicator of what's going on in the community. We want to get ourselves down to a level where of prevalence in the community, such that if we do discover a new case, we can trace it. And so we need the resources here to be able to do that sort of contact tracing, to figure out where did this person catch it, who have they been in contact with since. We need to keep an eye on those people, advise them, make sure that they're safe. And right now, the disease is just too prevalent. It's too widespread right now for that sort of approach to be practical. And then we need to decide, once we do get kids in schools, and I'd be curious to hear what the plan is for McAllen ISD, not just in terms of protecting the kids once they're there and try to minimize the risk of spread, but it is inevitable that there will be positive cases once school reopens, involving students, involving teachers. And what will the reaction be? And for how long will that reaction take place? And so I would say that my advice to the community is, one, to be patient, because we are figuring out new systems to deal with a new problem at a scale that we've never dealt with in the Valley before. And that poses a threat to the lives of so many people, everyone really. We're grateful that so far the disease seems to mostly spare children, though children are not entirely spared. And certainly If a parent gets seriously ill or a grandparent gets seriously ill, children are affected by those events in a family. So to say that children are not affected by this virus is not correct. Um, um, I think that the other thing is that we need buy-in from the community to heed the recommendations that are made by the community leaders, particularly those from the medical community. Things as simple as wearing a mask, while irksome as it may be, especially in the heat and humidity that we have down here, is really one of the most basic fundamental things that we can do to change the course of spread within our community, and to do it everywhere. And to encourage our children to do it, to require that they do it, within the four walls of the school and whenever they're interacting with one another in a close way. And we have schools here in the Valley that successfully enforce dress codes. This should be no different. It can be done. And while there will be hiccups along the way and it won't be perfect, it will be better than not trying at all. The other thing is to try to figure out what a new normal is for your own family. And it's difficult to understand right now what the long-term effects on the Valley will be from not being able to do those things. Um, I would say if we want those places to survive this pandemic, if we want them to be there at the other end, we have to get the spread within the community as low as possible, as quickly as possible, and then put into effect those measures that keep it there. I like to talk about the pandemic as being at a boil here in the Valley, and it is our job as a community to figure out a way to turn it down to a simmer, and then learn how to live with it there and keep it there. The number of cases is not going to go down to zero, but it does need to go down to a level that's controllable and is safer for everyone to get back to something that is very close to the way that we lived before the virus came here.
Yeah, those are all great points, Doc, and thank you for sharing that. As far as when you believe, I know you're talking about a semblance of normal and what we have to do to get there, but when do you believe our community will return to some semblance of what we knew as normal?
It depends on what we do as a community. If we adhere to a strict shelter in place, minimal going out, adhering to the advice that's coming from Judge Cortez, we could turn this around and get the numbers to where we need them to be to put into effect all of those things that let us keep it at a simmer in a matter of weeks. In the absence of that, I don't know how long it'll take. It could be months of this. Remember, our job as members of this community is, and as parents, well, we have lots of jobs, but one of them is to make sure that we create the safest environment for our children. And one of those is by supporting our schools. One of those ways is supporting our schools. If we want our kids to get back into the education that they desperately need, and there are so many reasons kids need to be in school. There's the brain drain that happens over the summer that we want to try and avoid with a prolonged break. We want to get them to catch up for the time that they missed at the end of the spring. We want them to have the maturation that occurs from interacting with their peers and interacting with their teachers. We want them to put themselves, those that are older, in the best place possible for their college applications, or wherever their careers take them after high school. My own kids are at the elementary school level, and it's tough. It's tough for them to be home, living in a box all the time. I trained in New York City. I can tell you that there were blizzards and winters where I literally lived in a box. It was a small 500 square foot room, other than going to work, you really didn't go out much, and that was tough as a single person. Now as a dad, with a family of 5, it's tough. I'm sure all the parents out there are feeling the same sort of stretching against the walls of the home that we are. Um, but that being said, it's the best thing for the community right now for that to be the case. I would encourage everyone to avail themselves of the of the new opportunities that McAllen ISD is offering in terms of the distance learning as much as they can. If your kids do need to go to school, and there are lots of reasons why kids need to go to school right now for a lot of families, then provide provide your support to the efforts that the school is putting in place to keep the kids safe. Keep yourself informed. Ask questions. Make suggestions. Be patient because we are all learning how to deal with this new world together. But I think what we all want is I think we want to get back to a better day-to-day living schedule than what we currently have. And again, the fastest way for us to do that is to follow the advice of our county officials, my colleagues in the community, many of whom have been such wonderful and effective spokespeople for what our community needs. Dr. Ivan Melendez, our public health director, has been an extraordinary voice at the national level at this point for the needs here in the Valley. I'd like to thank him, and then so many other physicians in the community. Talk to your pediatrician. Find out what he or she thinks needs to be done for your family, and whatever specific needs your kids have. The American Academy of Pediatrics has come out with a very detailed set of recommendations for the reopening of schools across the country, and they say flat out, the most important thing is to get our kids back in school. I 100% agree with that. I don't know any doctor who doesn't agree with that. But just like we don't send our schools at night when teachers aren't there, we don't send we don't send our kids to school on Saturday and Sundays because it's closed. We don't send our kids to school in the middle of an uncontrolled pandemic. And so what we need to do is we need to get it under control.
Well, Dr. Requenez, I know that you're busy protecting us all and doing all the work that you do at the hospital. And once again, I want to thank you very much on behalf of the entire McAllen ISD family and our Board of Trustees for giving us your time today and giving us your perspective as an expert in the field. Once again, I wish you and your family the very best. I know your children are part of the McAllen ISD family. And as you know, we're starting out our school year virtually. So our plan is
Right.
The first 4 weeks are going to be virtual all the way through, with teachers and everyone else working from home, with the exception of some essential employees. At the end of 4 weeks, we are going to come back to our board and then make a recommendation, and we could potentially go another 4 weeks that would take us into October. So that'll give us 8 weeks of runway if the board approves that second 4 weeks. And then at that point, we can come back and reevaluate how we're going to open safely and do all the things we need to do. But I'll definitely continue conversations with great physicians like yourself and others across the community, so that when we make these decisions as a district, that we talk to the people that truly understand what's going on from a medical standpoint. So once again, thank you very much for joining us today.
It was my pleasure. Thank you again for inviting me, and best of luck with your efforts. We look forward to what the new school year brings, and we're excited to see this chapter in our lives. Well, we're excited to see this chapter close.
Yes, sir. Thank you, Dr. Requenez. Have a wonderful day.